The Ministry of Health has launched a report by a task force that seeks to reform the National Hospital Insurance Fund and reposition it to support the universal health coverage agenda. The report has made recommendations to introduce a tax-funded scheme that will fund the health sector care to the poor and the underprivileged. Currently, only 25% of Kenyans are covered under the NHIF, and 75% stand to benefit from the coverage if indeed it takes off. NHIF will, upon the adoption of the reforms, move from being a commercial insurance provider to a social insurance fund. Now, this means that the fund will no longer be under the Insurance Regulatory Authority, but will now be regulated by the Parliament.
To pray for us, Dr. Warfa is the acting director. She's also one of the advisors in the CS office. Is Mr. Ben Mugambi. Mr. Ben Mugambi is a Chinese news agency.
Financial sustainability of both NHIF and UHC. There's no point of starting to build a house and then you cannot finish that house. So we needed to look at past NHIF, how it has its financial viability and sustainability, and when we introduce UHC through NHIF, how will that be maintained and made sustainable? And lastly, how would NHIF itself purchase health services on behalf of Kenyans in a way that ensures efficient allocation of the funds available, both raised by Kenyans directly or through the government through tax, how that would be allocated in an efficient way.
There was indeed a huge unmet need. Poor Kenyans in the 4 counties who previously were unable to access health care are now able to access health services. Number 2, in alignment with global evidence, the pilot exercise demonstrates to us that investments towards primary health care are able to address most of the disease burdens. It's documented up to 80%.